Right now, somewhere in a hospital, a woman is lying flat on her back under cold lights, beeping machines, a stranger in gloves at her feet, everything sterile, everything controlled, and every single part of that setup would have killed her 10,000 years ago. Because for 300,000 years, ancient humans gave birth in the dirt, on animal hides, under open sky, with no painkillers, no backup plan. And most of them survived. Here's how, and why the way we do it now might actually be the strange part. Let's start with the body, because the human body makes birth harder than it needs to be, on purpose. Around 6 million years ago, your ancestors stood upright. Walking on two legs reshaped the entire pelvis. It had to narrow. Narrow pelvis, better walking. Great. Except then the brain started growing, fast. 2 million years ago, human skulls began expanding rapidly. Bigger brains, better survival. But bigger skulls through a narrower pelvis, that is a geometry problem with no clean solution. Anthropologists call it the obstetrical dilemma. Evolution's answer was brutal. Babies are born unfinished. A chimpanzee is born with 40% of its adult brain already developed. A human baby arrives at 25%. The other 75% grows outside the womb, while the baby is completely helpless. Your species chose intelligence. The price was that every birth became a crisis by design. And it gets worse. In almost every other primate, the baby comes out facing the mother. She can reach down, guide it, catch it. Human babies cannot do this. The birth canal entrance is wide side to side. The exit is wide front to back. Those are rotated 90 degrees from each other. The baby has to corkscrew its entire body on the way out, and it emerges facing away from the mother.
She cannot see it. She cannot guide it. She cannot clear the cord from its neck by herself. Anthropologists call this obligate midwifery. Humans are the only primate that physically requires assistance during birth, not because of culture, because of physics. So birth was never a private event. For 300,000 years, someone was always there. And now picture where it actually happened. No bed, no room, no walls. The woman squatted. This is the part medicine got wrong for centuries. Squatting opens the pelvic outlet by up to 30% compared to lying flat. Gravity pulls the baby down. The muscles of the legs and core, conditioned from a lifetime of walking, foraging, carrying, were built for this. These women squatted every single day of their lives to cook, eat, gather, and rest. Their bodies were not weak. They were prepared. Sometimes they gripped a rope, sometimes a branch, sometimes another woman's arms. The group surrounded her, not for comfort, for survival. Because the next danger came the moment the baby arrived. The cord still connected the infant to the placenta. Someone had to cut it. There were no scissors, no clamps. A sharpened flint flake, napped to an edge thinner than a modern scalpel, was the surgical tool. In some cultures, the cord was bitten through. In others, tied with plant fiber and left to dry. Every method carried the same risk: infection.
One bacterium entering that wound could kill the infant within days. The mother was at even greater risk. The open wound inside her uterus where the placenta detached was a direct path for bacteria. No antibiotics, no germ theory. If infection took hold, it spread through the blood in hours. They called it dying after birth. We call it puerperal fever. And here is the brutal twist. When hospitals took over birth in the 1800s, the death rate climbed higher than it had ever been in the dirt. In Vienna's maternity ward in the 1840s, 1 in 5 women who walked in to give birth did not walk out. The doctors were going straight from autopsies to deliveries without washing their hands. A physician named Ignaz Semmelweis noticed the midwife ward had a death rate 5 times lower. He ordered hand washing. The death rate dropped almost overnight. The medical establishment fired him, called him insane, and committed him to an asylum, where he died of the very same infection he had been trying to stop. For 300,000 years, women survived birth by doing it the way their bodies were designed for: upright, surrounded, supported. And when the baby was out, the work was not done. The placenta was not thrown away. Almost no society on Earth treated it as waste. The Navajo buried it. The Maori had the same word for placenta and for land. In Bali, it was wrapped in white cloth and buried as a guardian spirit. It was the child's first companion. And then the baby had to eat. No formula, no alternatives, Breastfeeding was not a choice, it was survival. If the mother died, another woman in the group fed the infant. Communal nursing was not unusual, it was expected. The baby had to eat or it would die. That was the only calculation.
By the time a girl gave birth in a hunter-gatherer society, she had already watched dozens of births. She had helped, she had held legs, pressed on abdomens, wiped blood. Midwifery is one of the oldest professions on Earth, older than farming, older than writing, older than every religion that exists. This knowledge passed mouth to ear for 300,000 years. None of it was written. All of it was remembered. Today, a woman lies flat under surgical lights in a position designed for the convenience of a stranger, in a building full of equipment that did not exist 150 years ago. Her body has not changed. The room around it has. And that body, the one on that table, is the same body that gripped a branch in the savannah 100,000 years ago, breathing through pain no drug had ever touched, pushing a skull through a pelvis that was never quite wide enough, surrounded by people who knew exactly what to do. History hits differently here. Subscribe if it did.